This is the first presentation of the superintendent's proposed FY09 budget.
The budget drivers, the things that are pushing this budget, whether you looked at level service or at the $800,000 1.5% increase, the things that are driving it, fairly obvious by now to most people. Contractual obligations, including salary advancement, step and lane changes, those are the various ways. I spent a great deal of time last year talking about that cost of living or across the board increases are just one of three ways that teachers get improved compensation from year to year. A second is by advancing their degree, their academic degree, and a third is by years of experience. And those three things determine the total raise that teachers are eligible, and in fact some of our other employees as well. Loss of Medicaid revenue. The town has decided to retain $475,000 in Medicaid revenue from the federal government to the town this year, and they have told us to not expect to receive in the future any Medicaid revenue relative to our operational costs that we may be able to depend on that for capital improvement money, but it's been decided at this point that we should not depend on it, and so that $475,000 is a considerable amount of money, and so that's driving some of the stress on this budget. Stipends for mentoring. We're required by law to mentor all of our teachers. We're not required to have curriculum coordinators, but we need people to help us coordinate the massive amounts of curriculum that the state foists on us and requires that our kids know. And then stipends for extracurricular, non-athletic extracurricular, and extracurricular athletics. Health insurance. Our health insurance for all of our employees is going up 6% for next year, and we under budgeted from last year coming to this year, and so we're going to have to rectify that in this budget going forward, so that's driving a big increase in this budget. Special education costs, as always, inevitable tuition increases, transportation, and contractual services, most of which are they're out of our control in the sense that we don't directly provide those services. Kids are diagnosed, they're evaluated, there's a prescription of treatment that must be applied to those kids, and when we can't service those children here, we must go to other schools, other transportation providers, or other specialists where we don't hire a particular kind of specialist. We have to contract out with them to provide those services, and the state regulates those increases. The state approves them. We have no say other than we got to pay, and the state approves an increase, then we've got to eat that. And then lastly, utilities. While some of our utilities are still locked into a multiple-year contract, I think gas is open for review and renegotiation for next year, and we anticipate that the same experience people are having in their homes, we're going to have here, and it's going to be an increased cost for so again, when you look at the amount of utilities that we used up, despite our constant efforts to conserve that considerable amount of money. Current funding challenges. So the true level service increase in our budget would be $3.7 million, or a 6.7% increase. That growth is exacerbated by what I just told you is the loss of Medicaid funds at our disposal to use in the operational budget. The combination of those two makes for a 4.1 million or 7.4% increase. expected new revenue from the town, as discussed between the school committee budget subcommittee and the town council budget subcommittee and the town administrator, is in the range of 800,000. This is a little bit fluid, but we've been told it's not very fluid. It's not going to go down or up very much. What that does, bottom line, is from this year to next, despite $800,000 in extra funds coming to us to add to this year's budget, we will have to reduce programs and services, and mostly people, by $3.3 million to meet the $800,000 increase, the 1.5% increases versus the 7.4% increase including Medicare law. So these are big challenges, and I commend the principals. I haven't asked the principals because this is a general presentation, a preliminary presentation to you, and I suspect over time you're going to have more questions about it, and the principals will all be here and forced to help answer those, but they've done a lot of work to meet this particular challenge.